You wake up tomorrow with a toothache. You call a dentist. You get a shot, a few minutes of numbness, and it's over. You don't even think about it. But 200 years ago, that same toothache could end with four strangers pinning you to a chair. No numbness, no mercy, just a blade, a scream, and a prayer that it would be fast. This is what surgery used to be. Not rare, not distant history, just a few generations back. Picture an operating theater in London in the early 1800s. It isn't sterile, it isn't quiet. It's a room packed with spectators because surgery was a performance, and speed was the only thing that separated a surgeon from a butcher. The patient is awake, fully awake, strapped or held down by assistants whose entire job is to keep a thrashing body still enough to cut. There is no anesthesia yet. That word doesn't even exist in common use. The closest thing to pain relief is a shot of whiskey, a leather strap to bite down on, and sheer willpower. Why? Because the human body doesn't know the difference between danger 100,000 years ago and danger on an operating table. Your nervous system was built for one purpose: to make injury impossible to ignore. Pain is not a flaw in the system. Pain is the system working exactly as designed. Consider the writer Fanny Burney. In 1811, she underwent a mastectomy without any form of anesthesia. She later wrote a detailed account of the operation, describing the moment the blade touched her skin, as if her flesh had been struck by lightning. She remained conscious through the entire procedure. She remembered every second of it, for the rest of her life. That's the part modern minds struggle to grasp. It wasn't just pain. It was memory. Full, unbroken, permanent memory of the worst moment of your life, formed in real time, with nothing to soften it. So, surgeons adapted the only way they could. They got fast. Robert Liston, a Scottish surgeon working in the 1830s and 1840s, became famous for a single skill: speed. He could amputate a leg in under 30 seconds. Not because 30 seconds was gentle, because 30 seconds was survivable. Every additional second on the table meant more blood loss, more shock, more risk of the heart, simply giving out from pain alone. Think about that. A surgeon's greatest talent wasn't precision. It was velocity. And speed created its own horror stories. Liston is remembered, perhaps unfairly, for an operation where he amputated a patient's leg so quickly that he also cut off two of his assistant's fingers and slashed a spectator's coat. The spectator reportedly died of shock. The assistant died of infection. The patient died of gangrene days later. 3 deaths from one operation. And the story became infamous not because it was unusual, but because it captured exactly how brutal this era of medicine really was. Now ask yourself something uncomfortable. What did patients do with that fear beforehand? They didn't schedule surgery casually. They delayed it. They endured tumors, infections, and broken bones for as long as the body could physically stand it, because the operation itself was often more terrifying than the disease. Doctors of the time weren't being dramatic when they called surgery a last resort. It genuinely was. There was no concept of a routine procedure. Every operation was closer to a battlefield amputation than a hospital visit. So how did people survive the psychological weight of it, not just the physical pain? Some historians point to a strange kind of dissociation. Patients described leaving their bodies mentally, focusing on a single point on the ceiling, counting silently, praying, anything to create distance between their mind and the blade. This wasn't unique to surgery. It mirrors what modern psychologists now understand about extreme trauma. The mind, when it cannot escape physically, sometimes escapes the only way it can, internally. Then, in 1846, everything changed in a single afternoon. At Massachusetts General Hospital, in a room now known as the Ether Dome, a dentist named William T. G. Morton demonstrated something almost unbelievable. He administered ether to a patient before a surgeon removed a tumor from the man's neck. The patient felt nothing. He was calm. He was still. When it was over, the surgeon reportedly turned to the crowd of doctors and said, "Gentlemen, this is no humbug." That sentence marks one of the most important turning points in the entire history of medicine. Not a war, not a plague, a single word, anesthesia, from Greek roots, meaning without sensation. Within months, the news spread across the world. Surgeons who had spent entire careers racing against pain suddenly had a new option. Operate carefully. Operate thoroughly. Operate without the sound of screaming filling the room. But the transition wasn't instant, and it wasn't universal. Chloroform, popularized shortly after by the Scottish physician James Young Simpson, offered another path to unconsciousness, and for decades, doctors debated which method was safer, which was more reliable, which patients could tolerate. Anesthesia itself killed people in its early years. Dosing was guesswork. There were no monitors, no way to measure how deeply someone had gone under. Doctors were essentially calibrating unconsciousness by watching a patient's breathing and hoping for the best. Even Henry Beecher, a physician who later became one of the most influential researchers in modern anesthesiology, spent decades studying how inconsistently pain was measured and managed even after anesthesia became standard. His research in the 20th century revealed something unsettling. Pain isn't just physical. Context changes it. Soldiers wounded in battle, he found, often reported less pain than civilians with similar injuries, because for the soldier, the wound meant survival. For the civilian, it meant catastrophe. Which brings us back to that toothache. Your relationship with pain today isn't just biological. It's historical. You live on the other side of a threshold that took thousands of years, countless failed experiments, and an enormous amount of suffering to cross. Every routine surgery you'll ever have, every dental visit, every stitch, exists because of a series of discoveries most people never think about. You don't brace yourself before a checkup. You don't calculate whether the pain will be worth surviving. You don't bite down on leather and pray. But your ancestors did. For nearly the entire span of human history they did. And somewhere in your nervous system, the same ancient alarm system that made surgery unbearable in 1800 still exists in you today. It still fires when you stub your toe. It still floods your body with adrenaline when you're hurt. The wiring hasn't changed, only the world around it has. So the next time a doctor reaches for a needle, and you feel that small flicker of dread before the numbness sets in, remember what that flicker actually is. It's not weakness, it's memory, passed down through millions of years of evolution. From a time when pain meant the difference between living and dying. You're not afraid of the needle. You're afraid of the version of surgery your body still remembers, even if your mind never lived through it.